Hi, I'm Dr. Tala, and today we're going to go over our book recommendations for anybody that works in the NICU. Completely random order, so let's just go ahead and start. The first one is Merenstein and Gardner's Handbook of Neonatal Intensive Care. This is a fantastic book for neonatal nurses, and Arianna has recommended this several times. It's recommended often to new nurses in the unit. It's basically a really good balance between physiology and then also a lot of practical items. So the current edition is actually the 9th edition. This is the 7th edition. But even when I'm doing my videos, I go through this. Somebody gave this to me when they kind of upgraded to a newer edition. I go through this to kind of fill out any gaps in the videos that may be important for nursing care. Another thing I also really like about the book, it's kind of broken down into units, and one of the units is on common neonatal diseases. So for example, they cover ROP, the prevention and the different stages and the zones and everything. But also at the end of each chapter, it goes over the important things that parents have to know. So a whole bit on parent education. And I think that's really important for all of us as well. So altogether, brand new nurse in the unit or more experienced nurse or somebody rotating in pediatrics, I highly recommend this book. The second recommendation is a bit unusual, but hear me out here. And that is Clinical Microbiology Made Ridiculously Simple by Mark Ladwin and Bill Trattler. And I buy a new edition of this book every few years. And the reason why is that a lot of neonatology is concerned with infectious disease. We're obviously terrified about sepsis, we're constantly worried about torch infections, and we're always worried with treating them adequately. And this book goes through all the updates as well as all the basics in microbiology. As you all know, even the names of the bacteria are changing all the time. When I was in medical school, a lot of the bacteria were actually considered streptococcus, and since then, they've all become like completely different species. Same thing with antibiotics. There are new antibiotics all the time, and there are bugs becoming resistant to previous antibiotics. This book kind of covers a lot of that. It's also very fun and very silly. There's a lot of mnemonics and cartoons all the way through it, and it really helps me to remember all these details. There are so many things I remember pretty much exclusively from this book. For example, the cephalosporins that cover anaerobic bacteria, or the gram-positive rods that are in the world. So really, if you want to really get to the bottom of infectious disease and know your bacteria and your viruses better than pretty much anybody else, just read this book from cover to cover. It's a very easy read. Okay, the third book is The Red Book, which isn't just a clever name, it's a red book. So this is written by the AAP and it's updated every 3 to 4 years. So this current edition is from 2021 to 2024. And basically this is kind of like the infectious disease Bible. So this tells us exactly how we should be treating all the infections in the unit. So every time we have a baby with herpes or with syphilis, we go through this book and look up the exact treatment that we should be giving, which, by the way, sometimes they're written in a bit of a confusing way. Also, it goes through things that we see slightly less commonly. For example, a mother that has chicken pox. It's difficult to remember, do we have to worry about it when it's 2 days before delivery or 5 days before delivery and 2 days after, and when do we give the VZIG and when do we give the vaccines and everything? All that information is in this book. I have one of these books at home, and there's at least one of these books in every unit that we work in, and we refer to it all the time. Just as an aside, one of the few times that I don't really use the Red Book is for HIV recommendations. Sometimes the official HIV recommendations come on an off year from when the Red Book is published. So usually I try to find the latest recommendations online, and you can get those from clinicalinfohiv.gov. So just go look those up online. Okay, our fourth book recommendation is Cloherty and Stark's Manual of Neonatal Care. So you know all those notes that you take in training or when you're in the unit or during med school or nursing school or whatever, and you keep them on loose papers or in a binder somewhere? Well, this basically is the published form of all those notes. So it really emphasizes initial evaluation and then by step treatment that you should be considering. So for example, the few pages there are on pulmonary hemorrhage, it really talks about the diagnosis and clinical presentation and risk factors, but then it says, okay, this is what you should be doing. these are the steps that you should be going through to try to stop the pulmonary hemorrhaging and make it not come back again. Gomella's Handbook of Neonatology is very similar to this. If anything, Gomella's goes even more into details about treatments and dosages and gives kind of exactly what you should be doing with the medications as well. I have a copy somewhere, I don't know where it is, probably just shredded to pieces. I've used that so often. If you are rotating in the NICU, whether you are an NNP, a nurse, a resident, I highly recommend one of these handbooks. It's just a constant reminder of what you should be doing. Our fifth book is all about procedures, and it's called the Macdonald's Atlas of Procedures in Neonatology. And this book really is fantastic. It covers all the equipment that you need, as well as all the steps that you should be considering before you actually do a procedure. Obviously, it's not a substitute for practicing the procedure a lot, but it really sets you up as well as it possibly could. And there are very good diagrams and pictures throughout that really kind of remind you what you should be doing. It covers a lot of basic nursing procedures like placing an IV or getting a heel stick, placing an OG, in and out catheterization, as well as more advanced procedures like intubations and placing a PICC line. So overall, it covers pretty much everything that we do in the unit. So it's highly recommended that you have one of these books somewhere in their unit, just so that it can kind of be used as a reference book for everyone there. My sixth recommendation, and again, another book that we use all the time in the unit, is Smith's Recognizable Patterns of Human Malformations. It is an atlas of common syndromes and other congenital anomalies. So basically, it covers more common diagnoses like trisomy 21, as well as really rare syndromes like Fanconi pancytopenia syndrome. But I think what the best thing is about the book, and this is the way that I use it the most, is how good its index is. I mean, its index and appendix goes on for maybe 100 pages. By the way, I read once that you can tell how good a non-fiction book is by how good its index is. And when I first read it, I was like, well, that's a bit pretentious thing to say, and now I completely agree with it. Maybe I'm just really old. So anyway, you can go to the index, say you have a baby with a large tongue, and you can look up macroglossia, and it will literally list all the different syndromes that you should be thinking about if you do have a baby with a large tongue. So it really is very helpful when you see unusual symptoms in the unit. My seventh recommendation is the NRP book, or the book part of the Neonatal Resuscitation Program course. This is published every couple of years by a branch of the AAP, and as you all know, I'm sure, it covers everything that you need to do when you're taking care of babies in the delivery room, from before they're born to after they're born. So from healthy babies to the sickest newborns. And as you all know, we take a lot of the information in NRP and we then apply it to code situations in the NICU. This book is only a small part of the entire evidence-based course. There's also online testing, there are simulations, there's debriefing, there's lots of different parts that go into it to actually become NRP certified. But obviously the information in this book is kind of the basis for it all. So NRP is where the information is coming from about whether we should be suctioning in a meconium delivery, or when we should start chest compressions or start PPV, or how many mLs of saline we should be flushing after we administer epi. All of those details are in NRP and are given as recommendations every couple of years. Many units in the US actually require all the nurses to be NRP certified. And I would just suggest as well that even consider becoming an NRP instructor. From my own personal opinion, I think that you really get to learn the material even better when you actually have to teach it as well. Interestingly, in the last few years, NRP has put a lot more emphasis on other aspects of taking care of the babies, not just the direct patient care. So things like preparation and communication and teamwork and debriefing. And these are all really good skills that we should be emphasizing in the NICU as well. So definitely take a good look through that book. The eighth recommendation is the book of the Stable program. So this is kind of similar to NRP in that this is the book part of kind of the overall course course that you would actually become certified in. This is another program that many US nurses are expected to be certified in. But the difference between kind of this stable course as opposed to NRP is that this is after the babies have been resuscitated. So you've kind of gone through the NRP steps, you've gotten the baby to some level of stability, and then maybe you're sending the baby out to another hospital or needs to be transported, or maybe the baby was born in the ER. So it's just that period of stabilization before the baby gets to the NICU. Stable stands for sugar and safety, T stands for A stands for airway, B stands for blood pressure, L stands for lab work, and E stands for emotional support. So that's basically how the book is broken down into those units, and it really covers all the absolutely necessary basics that are needed when you're stabilizing a baby. This book provides excellent basic guidelines about how to take care of sick babies until basically more help arrives. So if you do work in the emergency room, or you work in a hospital without a NICU, or you're in a small rural hospital, then I would highly recommend that you get this book and pretty much read it from beginning to end. There are very few filler words in here. Every single word in here is extremely helpful, as is the entire course. My 9th recommendation is this Brodsky and Martin's Neonatology review. And I mean, to say that I tore this book apart is just an understatement. So I think I bought like 2 or 3 copies of this book because they kept falling apart. I used them so much. So basically, if you don't own this book, then you probably have very little interest in becoming a board certified neonatologist. This is actually the 1st edition. We're currently on the 3rd edition, and the 3rd edition comes with, like, it's double the size of this, and it comes with a bunch of neonatal board questions. It's quite advanced information, and it's broken down into really the basics that you have to know. So you do need a little bit of background in NICU to just kind of understand it, but I'm guessing that every single person watching this definitely has the background in NICU to be able to understand it, because there is also a bit of physiology and an explanation of why something is happening too. So it really is just an excellent book. For some reason, I didn't actually buy this book until I was really studying for the boards, and all I kept thinking was, why didn't I have this during my NICU fellowship? It would have just been so great to go through all the different body systems, or even during residency. Like, it really reminds you exactly what you do and don't know, and where you should be going and investigating further. So if anybody is interested in continuing and studying neonatology, then the sooner you get this book, the better. It's highly recommended. And my 10th recommendation, which I can like barely lift up, and this is kind of one of the 2 books, what we all kind of like really consider to be the Bibles of neonatology. So this is Martin and Fanaroff's Neonatal and Perinatal Medicine. So they are 2 huge books, and they cover really all the background physiology and pathophysiology that we need to know and understand in the NICU. Again, there are more recent editions than this. These are very old. I've had them for a long time. I've moved these massive books through like 7 different homes, but I still go back to them all the time. Obviously, the newer editions have much more up-to-date information, but for me, I know that the brain and the kidney haven't really changed that much in the last 20 years. So if I'm not understanding something kind of structurally, then I'll just go back to the basics. I know that now medicine is taught in kind of like a more case study way, rather than us just kind of reading all the way through textbooks and then trying to figure out what we apply clinically. But I learned in an age where we were like just reading textbooks. And so for me, it's kind of like a very safe space to go back and try to remember exactly the anatomy and the exact pathology and pathophysiology and physiology of what is going on. So I do love going back to these books. It is unbelievable how much information there is in these books. It is an investment, but again, if you ever want to look up anything, then you go here. Obviously, if you want newer information, then you're going to review articles in journals or specific articles that were recently published. But for the absolute basics, you really can't beat these books. Okay, so those were our recommendations, what me and Arianna can't really live without, and the books that we use most commonly on a day-to-day basis. What other recommendations do you have? Please let us know below, and remember to tell us where you're from. Like this video if it was helpful at all, and please subscribe to the channel and join our community if you're interested at all. Thank you so much for being here.